your parent in a nursing home does not mean you failed them, and I want you to take your time with that. You promised you'd never do it, but now you're exhausted, overwhelmed, maybe even getting sick yourself. And the most dangerous decision isn't always placement. Sometimes it's waiting too long. Today, we're going to talk about the gut-wrenching decision to place mom, dad, or another loved one in assisted living or a nursing home, and why that does not mean you stopped loving them. I'm going to walk you through the real clinical risks of trying to do this alone at home, what the research says about caregiver burnout, and how staying involved after placement can actually improve your loved one's outcome. So if you've been crying in the car outside of a facility, if you just signed the papers but still feel like a bad daughter or son, this video's for you. So let's get into it. The promise you made. Let's start with the promise, because a lot of us make that decision or that promise before we understand what's coming. I'll never put my mom in a nursing home. Mom took care of me, so it's my job to take care of her. A good daughter keeps her parent at home. If I place them, people will think I'm selfish. The thing is, most people make these promises before they've seen advanced dementia, total immobility, or full incontinence up close. 24 hours a day, 7 days a week? That's a lot. Most people are thinking about helping with groceries and rides to appointments, not lifting a 180-pound body that cannot bear weight, cleaning stool out of bed linens at 3 a.m., or trying to stop a confused loved one from wandering off. And listen to this. Guilt is incredibly common. Caregiver organizations report that 40 to 70% of family caregivers have significant symptoms of depression and guilt around not doing enough. That is a huge part. So you're not uniquely weak. You are having a human response to an inhuman level of responsibility. Okay, so let's talk about helping versus total care. Here's where so many families get blindsided. There's a massive difference between helping and doing total care. Early on, caregiving might look like grocery shopping, transportation, picking up meals, reminding about pills, helping with bills and appointments. That's heavy, but it's still compatible with a job, kids, and sleep. But advanced caregiving is a whole other job description. Transfers in and out of bed or a wheelchair, turning and repositioning a bedbound person every couple of hours, full incontinence care, feeding assistance at every meal, constant dementia supervision so they don't wander off, wound checks, dressing changes, medication management. There's so many things that need to be done for an aging loved one, and sometimes it's just too much for one person to do. National data shows that over half of family caregivers now perform medical or nursing tasks, things like injections, wound care, and complex medication regimens, on top of basic daily care. That's the work of an entire healthcare system, and many families are trying to do it with one exhausted person and maybe a friend or a sibling who helps when they can. So if you felt like you're secretly running a mini nursing home out of your living room, that's because you are. So next, I want to give you the clinical reality. Can I even keep mom safely at home? Love is not the issue. Most families love their person deeply. The real question is, can one exhausted caregiver safely provide the level of care this person now needs? Let's look at just one piece: a bedbound, incontinent, older adult. They need help turning because immobility is one of the biggest risk factors for pressure injuries, also known as bed sores. The only way to prevent those sores is to remove the pressure regularly. Guidelines emphasize repositioning on a schedule, not when you remember. Some pressure injury toolkits and caregiver guides talk about turning every 2 to 3 hours around the clock with individualized intervals based on the risk. That means day and night. Now add incontinence care every time they're wet or soiled to make sure you're keeping moisture off of their skin, daily skin checks on the pressure points such as heels, elbows, the backs of heads, making sure they get enough protein, calories, fluid so their skin can heal and their blood pressure stays up, safe transfers with gait belts, walkers, or lifts to prevent your back from giving out. And this is why facilities have rotating shifts of CNAs, nurses, dietary staff, and therapists, because this is not one person's job. So the question is not, can I keep mom at home? The question is, can I safely keep mom at home? And sometimes the honest, loving answer is just not anymore. Let's talk about something caregivers don't always get warned about: pressure injuries. These are wounds that form when constant pressure cuts off blood circulation or blood flow to the skin, common in people who can't move on their own. The biggest risk factors are immobility, constant pressure on bony areas, and poor circulation and poor nutrition. Caregiver guides and some facility protocols often use a turning schedule every 2 hours during the day and 2 to 4 hours at night for people at risk, individualized based on their skin and overall status. Research shows that regular repositioning schedules can reduce pressure injuries dramatically. One caregiver resource cites up to an 80% reduction when schedules are consistently followed. 80%. Why does this matter? Because once a wound opens, it can deepen to the muscle or bone. It can get infected, and that infection can spread to the bloodstream and lead to sepsis, which can be life-threatening. Sepsis organizations explicitly call out pressure ulcers as a risk factor for serious infection and sepsis, especially in frail older adults. And here's the part you need to hear. When one person at home is trying to work, manage a household, and also turn someone every couple of hours, it is not neglect when things slip through the cracks. It's an impossible workload. Many caregivers feel guilty even thinking about placement, while at the same time they're terrified of the bedsore that won't heal, that wound that keeps getting worse, the second hospitalization for infection. That's not you failing. That's one human trying to do a 24-hour job without a 24-hour team. Caregiver burnout hurts everyone. So let's talk about you. Caregiver burnout is a recognized condition, a state of physical, emotional, and mental exhaustion that happens when you're pouring everything into another person while neglecting your own needs. Symptoms look a lot like severe stress or depression, emotional and physical exhaustion, sleep changes, getting sick more often, withdrawal from friends and activities that you normally love to do, irritability or anger towards the person you love. Caregiver surveys in recent years have found that about 78% report feeling burned out, with many feeling overwhelmed weekly or even daily. Up to 76% of caregivers report poor sleep quality in reviews. And why does that matter for your loved one? Because burnout doesn't just hurt the caregiver, it can start to hurt the care. When a caregiver is exhausted or depressed, things like medication schedules, appointment follow-through, nutrition and hydration, daily exercise and engagement are more likely to slip. Research on caregiver burden has linked higher emotional burden to worse cognitive and self-rated memory outcomes in people with dementia. Other studies show that as caregiving tasks pile up, the odds of depression, sleep deprivation, and high perceived stress climb. A caregiver in stress or a caregiver in crisis cannot provide optimal care. That's not a character flaw, that's biology. And the longer we ignore it, the more we put both people at risk. So now let's talk about the caregiver health crisis. So if we're looking at the big picture, national data estimates that 63 million Americans are providing unpaid care to a family member, and that is up almost 50% from a decade ago. About 1 in 4 adults is a caregiver. Many are in what we call high-intensity caregiving, often providing 20 to 40 hours of care each week. Financially, caregivers spend thousands of dollars out of pocket each year, with some estimates suggesting about 26% of their income going to caregiving costs. Emotionally and physically, caregivers report high stress, anxiety, depression, physical strain, sleep problems, and that's about 38% of people reporting that. Professional organizations even describe caregiver stress and depression as a silent health crisis, and that is why I'm so passionate about it, because of how common and undertreated it is. So if you're noticing weight changes, constant anxiety, brain fog, snapping at people you love, or dreading the next phone call, that's a warning sign, not just something you should try and push through. So let's try to break down when a higher level of care makes sense. From a clinical and safety standpoint, there are some red flags that the current arrangement at home may no longer be safe. Your loved one is bedbound or needs 2 people for safe transfers. They're falling or almost falling frequently. They're wandering, leaving the stove on, or getting lost. They have wounds that are not healing or keep getting infected. You are turning alarms off at night just to get a few hours of sleep. You are skipping your own medical appointments, missing work, or having been injured lifting them. You're feeling hopeless, resentful, and maybe even like you might snap. At the same time, the care needs are climbing: more frequent turns, more complex wound care, more medications to track, more behavior management if dementia presents. In those situations, assisted living, memory care, or skilled nursing can provide 24-hour supervision and staff, safer transfers with equipment and trained staff, regular turning and repositioning schedules, on-site nursing to catch infections early, access to physical therapy, occupational therapy, and speech therapy, as well as structured activities and socializations. Health systems and long-term care guidelines emphasize matching the level of care to the person's needs and functional status, not to the family's guilt or promises. Sometimes that matching means saying, we've reached the limit of what's safe at home. Placement is not giving up. Placement is sometimes the care plan. And here's the point that sometimes gets missed. Placing your loved one does not mean disappearing. Your role shifts from exhausted 24/7 nurse to advocate, historian, watchful family member, emotional support. Research on family involvement in residential long-term care shows families visit frequently, help with personal items, and advocate for preferences. Involvement is associated with better psychosocial outcomes and can help maintain residents' function and quality of life. So, you can visit regularly at different times of day, attend care plan meetings where staff review your loved one's health, progress, and goals, ask about skin checks, fall risk and medications, bring in favorite foods if allowed, familiar blankets, photos, join activities like bingo, music, or outings. This is where I love the phrase, you still pull back the covers. And what that means is, you still check their skin. You still notice weight loss, swelling, or changes in mood. You still speak up if something doesn't look right. You still know them best. In fact, nursing homes and assisted living communities that encourage family involvement often see better resident satisfaction, more engagement in activities, and improved emotional well-being. So your presence is not optional. It's powerful. One of the quiet gifts of placement is that it can let you become their daughter, son, or spouse again. Right now, your visits might be showering them, changing the bed, sorting the pills, calling doctors, cleaning the house. Once a care team is in place, your visits can slowly shift to sitting and holding hands, looking through old photo albums and reminiscing, watching their favorite show, doing their nails, or shaving their face, just being there. Caregiver programs that reduce burden and depression, like structured education and support groups, show that when caregivers get support, their mental health improves and they can show up more fully in that relationship again. Placement can be one of those supports. Your loved one doesn't need a guilty martyr. They need a present daughter. They need a son who isn't exhausted. He can't remember the drive home. So now let's circle back to, I'll never put you in a nursing home. Most of the time, what your parent actually meant was, don't abandon me. Please don't leave me alone, and don't let me suffer. Placing someone in a setting where they have 24-hour care, regular meals, medication management, and people checking on them is not abandonment, it's protection. Articles and caregiver resources about placement stress over and over that guilt is a normal response, and that reframing facilities as specialized care centers, not punishment, helps many families cope. So try reframing your promise. I know I promised I wouldn't let you suffer or be alone. I promised I would make sure you were cared for, and this is what keeping that promise looks like now. Choosing additional help does not mean you failed. Recognizing your limits does not mean you love them less. Sometimes the most loving thing you can do is admit that one person cannot safely do the work of an entire healthcare team. Let me leave you with this. Your loved one does not need a hero who never breaks. They need a safe and effective care plan. They need their wounds turned and cleaned. They need meds given on time. They need people to answer the call light at 2 a.m. and they need you healthy enough to keep showing up, advocating, and loving them. Placement is not abandonment. Placement is sometimes how you keep both of you safe. If you're in that place of guilt right now, I want you to know you are not alone, and you are not a bad daughter, son, or spouse for even considering this. If you've struggled with guilt around assisted living, memory care, or nursing home placement, share your story in the comments. What was the hardest part of making that decision? And if you're still in the thick of it, carrying this secret weight, drop "I'm listening" in the comments so I know to create more videos just for you. Make sure you subscribe because we're going to keep talking about caregiver burnout, navigating this crazy healthcare system, and how to protect your own health while caring for the people that you love. And that's it for today. Thanks for visiting the Neighborhood NP. Until next time.